that has a covering around the outside. What is that called? Pericardium. So the whole surrounding thing that covers the heart is the pericardium. And then you have, remember I told y'all to put the hearts together. That won't work because they're the same size. So when you put the heart together, this is the front side, so this is the anterior side. And you have this sulcus that goes right in the middle of the anterior side. That's the anterior intraventricular sulcus. So it's the sulcus that goes literally between the ventricles. So if you split that, it goes between the two ventricles on the front side. So it makes sense. And it's the only sulcus you have to know. When in doubt, call that anterior intraventricular sulcus. Okay, and then intraventricular, left coronary artery, and cardiac vein. That is all, they're inside of there. You have to know that, especially on the cat, the coronary artery. You guys have to know? So my class, I told you, I just pointed out on the cat. Other classes, I'm sure your TA will, either one's fair game. Okay, so you have 4 compartments to the heart. What are the top 2?
Left and right atrium.
Left and right atrium. What are the bottom 2?
Left and right ventricle.
Left and right ventricle. So how do you tell the difference between sides?
The left side is thicker than the right.
The left side is a lot thicker. So this is kind of cut weird, but that's the thickness of the right side. That's the thickness of the left side. So which side is this?
Left atrium. Or, I'm sorry, left ventricle.
Left ventricle. This is the left ventricle. And then this in here, what's that?
Okay, left atrium.
Left atrium. So then this is
Right ventricle.
right ventricle. And all this up here?
Right atrium.
Right atrium. Everyone see that? Okay. So those are the ventricles and the atrium. And know the difference between the thickness of the walls. Left is always thicker, because which circuit does it go to? Do you remember? There's systemic and pulmonic. Okay. Which circuit does it go to? This is from the last class. Take a guess between systemic and pulmonic.
Systemic.
Systemic. One of y'all are right. Systemic. So the systemic is from the left side, and it's a lot higher resistance, so that's why those walls have to be thicker. Okay, the thing that separates both ventricles, what are those called?
Okay, so yeah, I just
septum.
Can I do that one? I don't have to.
So if I were to pin here, you would label that septum. If I said what structure,
But you can recognize that.
what compartment of the heart is this?
Left ventricle.
Left ventricle. What compartment of the heart is this?
Right ventricle.
Those are hard to find.
Right atrium. Left atrium.
Left atrium. Okay. So then you have the bicuspid valve. Remember what I told y'all? So when you already left the room, you said bi. So which valve, what does that separate?
Atrium and ventricle.
Left atrium and ventricle. So this right here, if I put a pin there, I would say what valve is that? That would be bicuspid valve. Or
So the bicuspid is in the left ventricle?
it's
Or like
bicuspid, when you left, you said bi.
Right.
And so it's between left ventricle and atrium. And so actually, don't pay attention to what I just did, because this is, like I said, cut weird. So what I do is I'd be like, okay, here's my atrium, here's my ventricle, what connects it? It would be this. Let's see if this one has a better one. So, not really. So it's actually this right here. Because this, if I stuck a probe through that,
That's your...
which would that be? This is the aorta. It's the left ventricle. So what valve would that be?
Aortic.
Aortic. The aortic valve. And a lot of the TAs will do this. They'll stick a probe through it and say, what valve is this? So I think this is a lot easier to tell than putting a pin in here. So this one right here is the bicuspid valve. It separates the left, what and what? Atrium and ventricle. I'm just going to drill this with you. Okay, then you have the tricuspid valve. What does that separate? right ventricle and right atrium. And so that's this right here. Same thing, you can put these on the models, all of them have that, but it's right there. It separates the right ventricle and the right atrium. Alright, what's next? Okay, then you have the aortic semilunar valve and the pulmonic semilunar valve. So what I did earlier, the aortic semilunar valve goes from left ventricle to the aorta. So that right there would be the aortic semilunar valve. My class, I'll ask you with the probe. I would ask you what valve is the probe going in. And I do know for everyone else, the other TAs do that. In terms of the other one. Okay, so this right here is your pulmonary trunk, and I just kind of tried to feed the probe through, and it does go through. So right there, what valve would that be? Pulmonic valve, that's what the book calls it, or pulmonic semilunar valve. So if your TA talks about semilunar valve, it's either this one, pulmonic, or this one, aortic.
And you just attach the name to the end of it, or to the beginning of it, like the name of the valve?
Pulmonic semilunar valve, yeah, or aortic semilunar valve, depending on what it's going through. So if I have a probe like that and I ask you what valve that is, that's pulmonic valve or pulmonic semilunar valve. Okay, and then, so this, if I pinned that, what would that be? This thing right here, this big old hunker.
Aortic?
Yep, it's the aorta. You can also ask that on the cat. It's the aorta, it's an artery. You see it on top of the heart. Usually it crosses over the heart, it kind of curves. So that's the aorta. And then we have pulmonic trunk. Like I said, that's this on this one. Most of the time, the TAs will ask this on the model, just so you'll know. Usually this is a model question. I can't tell you that for sure. I'm not your TA. For my class, it will be on a model. But I do know most of them, that gets cut off a lot, so usually it is a model. The inferior vena cava and superior vena cava, it is not on here. It would be on the model. If you look on the model, it's right next to him. We point to see, yeah, right where your pointer finger's at. That's superior vena cava. And then underneath there, right here, D is inferior vena cava. And that's on all the models. And then just look, it's right next to the atrium. So if this is a full atrium, you guys can see that's the right atrium. It goes up and down to the atrium.
And that would be a model question, most likely? Or?
Most likely, yeah. Because most of them, it's not on here. You can see it on the cat. Like I said, that's also on your arteries and veins sheet that we did this last week. You can label superior and inferior, but on just the heart, most of them don't have it on here. I already told you all about the coronary arteries. Brachiocephalic artery, same thing. Usually that's on here. That's the first branch off of the aorta. When it curves around, this right here is the brachiocephalic artery. Or, you guys learned it on the cat also. You walk through and learn them all over the heart. Ligamentum arteriosum, same thing. It's on the model. It's that ligament, and what does it turn into? What turns into the ligamentum arteriosum? Is it the white part? What did you say? Ductus arteriosus turns into the ligamentum arteriosum. The ligamentum arteriosum is that remnant that remains. I'm guessing that white part's supposed to be it. In the other model, it's a real thick white part. We can't ask that to you on the heart. We'll ask it on the model. Yeah, that right there. So that's the ligamentum arteriosum. This one right here. Like I said, on the fetal pig, it's the ductus arteriosus. So myocardium. If I were to pin this muscle, what would that be? And ask you, what muscle is this? Myocardium. Myocardium is the muscle at the bottom, the apex of the heart. Then you have the chordae tendineae. If I put my probe through here and I ask you what structure is this, what would you tell me? Chordae tendineae. If I ask you what valve, what would you tell me? Bicuspid.
Oh, yeah.
So chordae tendineae are all these little cords. And then you have, if I asked you, what muscle is that? Trabeculae. That's the muscles on the inside of the ventricles, all the little spider web-like things. That's the trabeculae. It means bumpy. And then papillary muscles are these right here. So if I were to pin at the bottom of the chordae tendineae, that's the papillary muscle. And don't get those confused with pectinate muscles. So papillary muscles at the bottom of the chordae tendineae, and trabeculae is in the rest of the ventricle. Okay, and then pectinate is the ones inside of the atrium. So if I were to pull an atrium apart, and I pin that, and ask you what muscle that was, that's pectinate muscle.
So like on the
And that's only on the right side? It's on both. It's on both sides. So if I pin...
But most of the hearts don't actually have this intact, so I never really seen one that nice. So chances are
in there, and I ask you what muscle that is, that would be pectinate. It's hard to see, and I would probably do it more on one that I can actually pull open and show y'all.
And where would you pin for like the atrium again?
The atrium, I would ask you what chamber of the heart is this. So that's why this test in particular, really pay attention to the questions, and that goes for all of y'all. If it's looking for muscle, if it's going for chamber, what it's looking for, pay attention. The question should state it in there. Now the one that I would say structure is I'd say what structure is this? Compared to what valve or what muscle. And then the rest are all on the cap. That's it. Everything with the heart.